Everyone, welcome back to Overseas Nursing Band. This is Jane. I'm back again, and I would like to ask you, how are you? How are you doing? Are you all right? Have you been taking care of yourself? Okay, I believe you have. All right, so we know what this channel is all about. We discuss everything overseas nursing. So you studied nursing in other country other than the UK, and you plan to come to the UK to work as a registered nurse. Overseas Nursing Band teaches us all the processes that is involved in coming to register and work here with get your NMC pin. So you from writing your IELTS and all that, and to doing your OSCE. Okay, so if you check my old videos, you will see the things that I have done, the videos that we have on taking you through all these processes. Okay. All right, so I just want to say, please, if you think you like what you're seeing, can you subscribe to my channel? Also, can you make comments, ask me questions? Is there anything you want to see? I know I have one or two questions that I think I should really deal with, but oh my gosh, I have been so overwhelmed with work and family life that I have not been able to keep up to making videos once a week even. But never mind, I will do my best and I will try and make videos to answer those questions. Okay, thank you. So today what I just want to do is videos when you go for your OSCE, so implementation process. So that's when you give your medications and all that. I just want to acquaint us with some of the medications that you might likely find, so we'll discuss about them. Okay, and anyway, too much of babbling, let's ride on and get into this video. Come on with me. So you're in the UK and you're in the OSCE and implementations, and you're wondering, oh, how will you know what medications? The truth of the matter is mostly medications that we are used to. No, it's for you to know why and what it's taking. So I'm just going to go straight ahead. One of the commonest medications you find is paracetamol. And what is the dose and frequency? Is 4 hourly. It must not exceed 4 doses within 24 hours. And obviously you know what paracetamol is. The therapeutic effect is an analgesia, antipyretic. And what drugs? So some of the things that they set out as traps when you're writing your exams, they might put saying this patient has PRN cocodamol, for example, or PRN paracetamol, and then paracetamol or cocodamol is prescribed. So once you see that this patient has had PRN cocodamol, you cannot give paracetamol again because you'll be overdosing this patient. And what you have to look at also is the weight of your patient when you're giving this medication. Okay, and then the next one we'll come to is still ibuprofen, which is 6 to 8 hourly. You must not exceed 3 doses in 24 hours. Okay, and then it's also an analgesia, is an antipyretic, is an anti-inflammatory. You cannot use it with other NSAIDs. You cannot use it with warfarin. You cannot use it with verapamil. And it's what you have to put in mind, consideration, is that if you have allergy to aspirin, you cannot have ibuprofen. Okay, and then we go to aspirin. Usually is an anticoagulant dose daily. So people that have tendency, just for thinning of the blood, so people that have tendency to have blood clot, or maybe people that have heart conditions, they might have, you find that they give it to people at certain age, usually for daily dose, just so to thin the blood, so they will not suffer blood clots. Yeah, okay, so you cannot use this with other NISDs and warfarin. Obviously we know what warfarin is. And then if someone has stomach ulcer, you cannot give them aspirin because we know what it is. And then warfarins depends on your patient's INR daily, because usually every day or every week you check the INR out. So depending on what the level is, then you can give your warfarin, because you can find out that sometimes in a day the doses changes 3 times. Maybe you take a certain dose in the morning, in the afternoon, and in the night, things like that. Okay, so that is just it. Anyway, warfarin is incompatible with a lot of medications. It's incompatible with even some drinks, some juice. So if you're not supposed to be on certain juice drink if you're on warfarin. And the next one is cyclizine, which is 50 milligram 3 times a day. Is an antiemetic, so it helps if somebody is feeling nauseous or already vomiting. You give them cyclizine. Okay, and then there's no major interactions with cyclizine, but it makes you drowsy. So if you take cyclizine, you're not supposed to drive or operate some heavy machineries. Yeah. And levothyroxine, 100 to 25 micrograms daily. So this is to treat people that have underactive thyroid glands. It interacts with aspirin, calcium, ciprofloxacin. It's better to give it on its own, as not effective if given with some other medication. So most times you find out that it's given early in the morning. If you have a resident, for example, they would have given it most times, 90% of the time, is given just the way you give alendrolic acid or you give omeprazole first thing in the morning. Most times that's the time you give it to your patients so that it works better on its own. Prednisolone is 30 to 40 milligrams daily, depending on the condition. It's a cortical steroid which reduces inflammation. So you find out people that have that are asthmatic or some sort of inflammations, or it helps to reduce such inflammation. Okay, you don't take it on empty stomach, no, and it's, if you are taking ciprofloxacin, you don't take it. Okay, and then calcium, 600 milligram 1.5 gram day to 1.5 gram daily. So this is for people with low calcium, osteoporosis, especially for us women. Yeah, osteoporosis is common due to childbearing and all that. So you don't give it at the same time as ciprofloxacin. It can upset your stomach. We have magnesium. It's 250 milligrams. Low magnesium. That's the reason why you give it, and it could upset your stomach as well. Ondansetron is 8 milligram TDS, antiemetic. That's what it is. So it helps to stop vomiting or nauseous. So it's compatible with other antiemetic drug, but it can lead to constipation, obviously, if it's stopping you from vomiting and all that. So the possibility for you to get constipated is there. Atorvastatin, 40 milligram. This reduces bad cholesterol. And what happens usually, you find out that they like to give it at night so that when it works when most times when at rest, something like that. So it's compatible. You don't give, if you're on clarithromycin or lansoprazole, you don't take it, and then it causes stomach upset, obviously. So, and then other mixed group of medication. So you see this medication in your implementation, either of them, it could be 3 of them or 2 of them or 4 of them that you might have to give, between 2 or 3 that you might have to give. Also, the medications you find again is antihypertensive. So for people that are hypertensive, and you also know that when you're giving some of this medication, you have to check the blood pressure, you have to check the heart rate, for example, when you're giving this medication. So we have verapamil, which is 120 milligram daily. It's antihypertensive. It stops arrhythmias and anginas. And you do not give it with bisoprolol, atenolol, erythromycin, ibuprofen, and some statins medication. It definitely causes dizziness. Okay, and then obviously bisoprolol, we've talked about it earlier, is 10 milligrams daily for hypertension. You don't give it, you don't give verapamil and bisoprolol the same time. They cause dizziness. Atenolol, it's 50 milligram daily. It's hypertensive and for angina. It's counteracts with verapamil, causes dizziness. Enalapril 10 milligram for hypertension and heart failure. You don't give it with some statins medication, it causes dizziness. Nifedipine is 10 to 30 milligram depending, so it's an antihypertensive as well. It causes dizziness. Amlodipine is 5 to 10 milligram, is an antihypertensive, causes dizziness. And you also have metoclopramide, which is 10 milligram, is an antiemetic, so it helps when someone is vomiting or when someone is feeling nauseous. You give metoclopramide, and it reacts with chlorpromazine. It's safe with ondansetron. It's safe with it. Okay, I had to say that several times. Chlorpromazine as well is also an antiemetic. You give it 10 to 25 milligram, 4 to 6 hourly, is an antiemetic and also an antipsychotic medication. You don't give it together with metoclopramide. It is safe to give with ondansetron. It is safe, but it causes drowsiness. Furosemide, you most likely see furosemide. Obviously, it's an antidiuretic. So somebody that is hypertensive, you want to reduce the fluid, or maybe they have swollen legs, and all your antihypertensive medication, you have to know the baseline of your patient and know when not to give and when to give, because if the blood pressure, for example, that is on furosemide is below a certain baseline, then you cannot give your medication. So it's very good you ask your assessor, what's the blood pressure of XYZ. If they say, for example, is 120/80, you're free to give, for example. So it's for you to find out. Read your paper, your instructions. Don't rush over your reading, okay? So you don't give an furosemide is a diuretic. You don't give it with clarithromycin or digoxin, ondansetron or saltalol. And it can cause hypotension with antihypertensives. Patient able to go to toilet, because when you're giving furosemide, is a diuretic, it makes them to go to toilet constantly. It makes them to, because you're trying to reduce the fluid, so it makes them to go use the toilet a lot. Okay, so you have to be careful. So if the blood pressure is low already, obviously you don't want to give, because one of the things can cause hypotension. So you have to check to know what's the blood pressure blood pressure of your patient before you give, and you also have to monitor the blood pressure of your patient. Okay, all right. And then we go to digoxin. It's 2.5 to 2.5 milligram, and it's for arterial fibrillation or Flutter. You can give it with multiple medication, and you have to check the pulse and know before you are able to give. For example, if the pulse is less than 60, you cannot give. Okay, thank you. Very important. Ask for the pulse. Assessor, what is the pulse rate of my patient, Mr. TJ, for example, and they tell you is 59 or is 58 or 40, definitely then you say, I'm going to skip for now, right? All right, let's move on to antibiotics. So we have the penicillin. So 500 milligram QGS contains obviously penicillin. Amoxicillin 500 milligram TDS contains penicillin, and they cause stomach upset and rash, both of them. And what you have to understand is that if your patient is allergic to penicillin, so you cannot give amoxicillin, you cannot give penicillin V. You have to look for another antibiotics to give. So if you have a patient and one of their reactions, one of their allergies to penicillin, and then during your implementation, so you have to watch out during your implementation, and they're giving amoxicillin or flucloxacillin or coamoclav, you won't give them, because you have to give them either clarithromycin or erythromycin or clindamycin. All of those ones, they don't contain penicillin, so they are okay with them. You can give to them. But once it contains penicillin, just watch out, be very careful when you're doing your implementation. So like we said, your clarithromycin is 250 milligram to 500 milligram BD. It doesn't contain penicillin, but if you're taking atorvastatin or digoxin or erythromycin or warfarin, you cannot take it, and it causes stomach upset and rash usually. And some people might experience nausea and vomit. I think the easiest things medication causes nausea and nauseous, stomach upset, things like that, is if your mind goes blank, that's the easiest thing to say. Okay. And then erythromycin is the same thing. You can't give it with clarithromycin or atorvastatin or verapamil, stomach rash and all that. And clindamycin doesn't contain penicillin. So, and then flucloxacillin contains penicillin. Coamoclav contains penicillin. Okay, so these are one of the commonest medications that you can find during your implementation in your OSCE. And inhalers and nebulizers, for example, you usually do not give it during your implementation. It's a different procedure on its own when you're doing your AIM, yeah. So that's when you do your inhalers. It's a different on its own. You have a mannequin for the for implementation, so you're not expected to give to them. Okay, but what happens sometimes, you have a patient that is there's an asthmatic patient or has a respiratory condition anyway, and you might get a question, so they have inhaler in their chart. Your assessor might decide pardon me, your assessor might decide to ask you a question based on that. Otherwise, you will not give any of this. But it's just good to know that your inhalers, they are your broncho. It's good to know what your inhalers does, and it's good to know which ones are your bronchodilators and then which one are your steroid meds and all that. So just have an idea of all of those things. All right. So hopefully I'll be able to get you something quicker. That's the end of it. There are also many other medication, but these are some of the commonest. Even when you start working in the hospital or your care home, wherever you get to work, you will find out that this medication will help you. So we've come to the end so far. By no means this is not exhausted, and I just want to acknowledge that I got this off the internet. Okay, this list that I've compiled here. So thank you so much for listening in, and I hope this has helped you in some way, and I'm wishing you all the very best in your upcoming OSCE. And to those that are in our group that have passed their OSCE recently, a big congratulations. And for those that are yet to, they are going to write this October, November, December, wishing you all the best, and I'm praying you're coming out with, in fact, I'm just giving you a congratulations in advance, because I know you're coming out successful. You're smart and intelligent nurses. You've made it all. You've crossed 7 seas and 7 mountains to come to the UK. You're not going to be a failure. God bless you. Bye.